Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry and promotes the highest standards of patient care with today's top experts in the field. Now here's your host, Dr. Joel Berg.
We are here today with Dr. Amy Dunleavy. Dr. Dunleavy is clinical assistant professor at the University of Iowa. She graduated from the University of Iowa College of Pharmacy in 2020. After graduating from the University of Iowa, Dr. Dunleavy completed a residency in community-based pharmacy at Osterhaus Pharmacy in Maquoketa, Iowa. Dr. Dunleavy joined the University of Iowa College of Dentistry faculty in May 2022 as a clinical pharmacist. In her role, she is responsible for managing the in-house dental pharmacy and teaching pharmacology to dental students and residents. Dr. Dunleavy, thanks for being with us on Pedo Teeth Talk.
Thank you so much for having me. I'm excited to be a part of this and share some of my experience in dental pharmacy with all of your listeners.
Well, the timing couldn't be better. There are so many questions that have come up over many years and particularly recently, and we're going to try to get to as many of those as possible in our short time together. But first, I have to ask you to tell our listeners, how did you as a pharmacist, and you started your career recently and during the pandemic also, we may talk about that later, how did you end up at a College of Dentistry, and specifically the University of Iowa College of Dentistry?
Yeah, so as part of my pharmacy training, I had the opportunity to do a shadowing experience with Dr. Cindy Merrick here at the College of Dentistry, and she was able to show me a bit of what she does in terms of compounding. After that shadowing experience, I then ended up working as an intern here at the College of Dentistry, and after graduating, going on to do a residency, was contacted that Dr. Merrick would be retiring, and that if I was interested in pursuing a career in academia, that I was encouraged to apply. And so here I am now, just a couple years later, in what I would consider to be a very unique position in pharmacy. There are not many pharmacists working in the dental realm at this time. We're starting to see more pop up in some of the different colleges of dentistry, but the University of Iowa is definitely a pioneer in the field.
Yes, and I'm well aware of that personally. And full disclosure, I'm a graduate of the University of Iowa, and we had Karen Baker, a pharmacist, still there, you informed me, teach us many years ago. And it's been sort of a legacy of the University of Iowa. And we're going to talk some more about that. And given your role in dentistry, pharmacy, what would you say your experience is in the role of a pharmacist in dental care? Because it seems that you just alluded to it, that there's a growing need to connect with pharmacy. Tell us a little bit about that.
Yeah, so pharmacists are well known as being the expert on medications in the healthcare field. And as we continue to have more drugs developed, we see an increase in the different biologics used. We see more frequent occurrences of different oral side effects or even oral conditions. So pharmacists can play a very instrumental role in identifying drugs that cause things like dry mouth. We think of drugs that help with helping retain bone density. Our different osteoporosis drugs can actually have some negative effects in the oral cavity in terms of oral necrosis. We also can help to serve as a healthcare practitioner that can help with screening for different types of conditions. So one of the things I do here at the College of Dentistry is help with identifying different things like blood pressure if we're having elevated blood pressures. I also help with doing point of care testing for things like INR for our patients who may be undergoing a more in-depth procedure and are taking the drug warfarin, as well as we're recently rolling out looking at A1Cs and screening for potentially those patients who may be having higher than expected or really what we want prior to doing major extractions and work. So a pharmacist can play a role there as well.
So something like an A1C where I'm imagining you're identifying undiagnosed diabetes or prediabetes?
Oftentimes it's looking and identifying, yep, we maybe see some pre-diabetes or undiagnosed diabetes as at play. We also will use the screening if we have someone who has known type 2 diabetes, maybe hasn't been controlled the best, doesn't remember the last time they had their A1C taken, maybe has admitted to not being compliant with their medications. We can take that A1C, kind of see where they're at, and develop a treatment plan around that.
Wow, that's incredible. We talk a lot about the integration of healthcare. Pharmacy is sort of the connector to all aspects of healthcare, and the fact that we're seeing this in dentistry, I think, says a lot about what we're about to talk about is the connectivity to oral health and total health.
Yeah.
So are you seeing, you mentioned before the growth of pharmacy together in dental education? Are there other institutions that you're hearing about that are bringing this on board?
Yeah, so we're starting to hear of some other institutions bringing it on board. My most familiar is still located here in the Midwest. Creighton in Omaha, Nebraska has done some work with integrating pharmacy. There are a couple places in Tennessee, more in private practice, that have started to integrate pharmacists into their offices. And forgive me, I don't remember if it's North or South Carolina, but one of the Carolinas has started to integrate pharmacists into the dental school as well.
And because we as dental care professionals, we recommend a lot of OTC products. We often don't get all the training as they change. Do you carry a full line of oral care OTC products as well in the pharmacy?
Yeah. So in our pharmacy here at Iowa, we are a full functioning pharmacy. So we do carry even things like insulin, blood pressure medications, primarily faculty staff, maybe people just local to the area will fill those medications with us. But then we have a very wide array of different types of toothpaste. Of course, your high fluoride toothpaste. We have a number of different oral rinses, going with some of those alcohol-free, less abrasive mouth rinses. We carry a lot of different products for dry mouth. We see a lot of our patients struggling with dry mouth. So when we can, we try and provide insight to what maybe is causing some of that, especially from the medication side. We can talk with both the dentist as well as the primary care provider to see if we can make some medication changes. And if we can't, we can make recommendations on different over-the-counters that might be an option for those individuals, ranging from saliva stimulants to saliva replacements.
Yeah, I wonder that I can't help but believe that the fact that there's a pharmacy on site where the patients are treated, whether compliance is improved based on the recommendation, whether it's OTC or prescription products. Do you have any information on that?
Yeah, so I know when we talk with different patients about their medications, the first thing is just identifying perhaps what the medication causing the dry mouth is. A lot of times, I'd say the most common one we see are different antihistamines we use for allergies. So thinking of things like our Benadryl, our Claritins, our Zyrtex, making a small adjustment there where we go with, instead of using Benadryl 3 or 4 times a day, let's try something different like a Zyrtec that tends to be less drying. So there's just a small change we can make. Also then identifying patients who maybe are experiencing more dry mouth at meal times, and maybe we're noticing their nutrition status is falling a bit. If we can provide insight to, let's use the saliva stimulant before we're having a meal, we can see that they are better able to eat their meal. We can see improvements in nutritional status there as well.
That's fantastic. When we were talking about all the different subjects to discuss with you today, one of them that kept coming up from our listeners is about drug shortages over the pandemic and recently in particular. I've heard from people around the country, and it varies depending on location, shortages of things like amoxicillin, of children's ibuprofen and acetaminophen. I've even heard about Demerol shortages for our sedation. Can you comment on that? Is it true? Where are we with those kinds of shortages, first of all?
Yes, we are still seeing those shortages occurring. The amoxicillin shortage has been primarily with just the oral suspension. that we are using frequently with our pediatric patients. Some alternatives that are more readily available are the chewable tablets. We haven't seen that same shortage there, as well as the oral capsules. Our doses that we use in kiddos does tend to be a bit lower than what is commercially available in those chewable tablets or capsules. So one of the things that pharmacists can do are actually open up those capsules, make a compounded product in the concentration that's necessary for a child potentially. With the ibuprofen and acetaminophen shortage, there unfortunately is not a great alternative for kids in terms of those medications. And so, what we have been doing a lot of is when we're able to um, bumping maybe a child up to the adult dose if they're able, based on their weight, to take that, doing things like splitting tablets in half when that can be done. With both ibuprofen and Tylenol, if a tablet is split in half, it can be crushed and sometimes make that a little bit easier for a child to take. The other thing is just pharmacies staying really on top of those drug shortages and ordering in that supply when it is available. We see that manufacturers still have the products, but are just slowing down that release of the products quite a bit. So part of my job is to keep close eye on our different wholesalers and manufacturers and making sure to order in the supply so we can serve our patients.
Are you seeing this with narcotics for sedation, such as Demerol?
We do see it with narcotics as well. Demerol, I have not had an issue here ordering that, but have heard that reported from a number of our practitioners. We also were seeing a bit of a dip in terms of things like hydrocodone and oxycodone as well for more of your adult patients too. So we can oftentimes see from our different ordering manufacturers and vendors when we see that kind of dip in supply. And so that's a key sign that we want to make sure we're either looking for alternatives or stocking up on that supply.
We will now pause for a word from our sponsor.
Do you need additional CE hours but don't have time to travel to courses? Did you attend the annual session and want to listen to the audio recordings? Check out AAPD's Education Passport, an online learning center, where you can earn CE and listen to audio recordings from all of our continuing education courses and more. Visit educationpassport.aapd.org.
We are back with Dr. Amy Dunleavy at the University of Iowa College of Dentistry. She's a pharmacist, and we're talking about a whole host of issues related to pharmacy and dentistry. So, Amy, you spoke a moment ago about compounding, and I've heard of it. Some of my colleagues have had their own potion of topical anesthetic made, and I think that's compounding. What is compounding, first of all?
Yeah, so compounding is something that pharmacists are experts in. So it's taking an active drug ingredient and putting it into a vehicle that can be delivered either to a different area of the body. We think of things like topicals, or taking an active ingredient, putting it into a vehicle that maybe adds something additional or take something out of what's commercially available to make it more acceptable for that particular patient.
So in the case of like topical anesthetics, I know several places I've lived, everybody knew that one pharmacy that would make this potion for them that they swore by, that nothing else worked. This is the one that works. First of all, since I'm this is a pediatric dentistry podcast, is that a good example of a compounded agent for pediatric dentistry?
So we do use some of the topical analgesics for our pediatric patients, primarily in-house in the clinic. We don't make a large number that go out the door with our patients. Some compounding pharmacies do. That's just not a population we're seeing quite as much here. We do quite a bit of the chlorhexidine gel for our kiddos, as well as some of the different oral rinses for some of our children as well.
And I think you said related to, and this may be more for adults with temporomandibular disorders, that you have some kind of topical remedy. Is that right?
Yes. So for TMJ, we do a number of different topical variations ranging from products that contain the ingredients of cyclobenzaprine, a muscle relaxant, and ketoprofen, a nonsteroidal anti-inflammatory, and then lidocaine in it as well. So there are a few different options you can put into a topical to help treat just that TMJ area without having the systemic effects that some of those drugs bring.
Is that a relatively new thing for TMD, that you could use topical agents for?
Yeah.
They're normally systemic?
So in my time since being an intern, it's been something I've seen at least for, I can speak to the last 6 or so years. I think we're seeing it used a bit more frequently now than we historically had, especially with some over-the-counter options. Diclofenac or Voltaren is an over-the-counter nonsteroidal anti-inflammatory. We're seeing that particular product being a bit more frequently used for some of our TMJ patients. The compounded prescriptions, I certainly am seeing more prescriptions come in from some of our local providers outside of the College of Dentistry in comparison to what I had previously.
I would imagine the effectiveness of these topical agents is something that has to be evaluated on a case-by-case basis, whether it's only effective systemically, it can go through the skin. And so is that pretty well established, which ones would be effective topically versus not?
Yes, yes. So there is a lot of data out there regarding the penetration of particular drugs through the tissue, as well as the concentrations in which are therapeutic. So we actually are able to use a much lower dose of cyclopenzaprine, for example. When we're applying it topically to the TMJ area, we can really get down to about 2% and sometimes even less in comparison to an individual systemically having to take something like a 5 to 10 milligram tablet. When we're applying it topically, we don't see those side effects of drowsiness or cognitive impairment. Systemically, we just about always do see some of those systemic effects. So it's a really good option to avoid drug-drug interactions and risk.
So if I'm living wherever, someplace outside of Iowa City, Iowa, and I'm thinking about, wow, I'm inspired that there may be a topical agent that I could get formulated as compounded rather. How do I find a compounding pharmacist in my area?
Yeah, so there are a few different ways. The first thing is just in your search engine, looking for compounding areas in your location. There are a few national organizations that do have compounding pharmacies associated with them. One is a organization called PCCA, and it's a Pharmacy Compounding Association. They have a website you can go to. It's pccarx.com/resources/find a compounder. You can plug in your zip code. It'll tell you the closest compounding pharmacy to you. The other organization you can look at is ACHC, and that website would be achc.org/find-a-provider. And again, typing in that zip code and you can quickly identify a compounder in that area.
And I imagine, since we don't know nearly as much as you do about what's possible, so if you call these compounding pharmacies, you might then get into a conversation as the provider, as the dental provider, about these are the kind of conditions where I struggle with finding the right cure or treatment rather for my patients. And you would get into a conversation about the options and maybe even come up with
Yes.
something different that hasn't been tried. Is that?
Yep. So typically when I'm talking with a provider about potentially creating a compound, the conversation starts with, what are we trying to treat? Then we go through a few of the different options of what maybe is commercially available already, or what type of drug would we like to manipulate into a different delivery system. From there, looking at what delivery system is best for that particular area and putting it into that vehicle, whether it be an oral suspension, a capsule, a tablet, a topical. We can identify how best we will get therapeutic efficacy.
That's incredible. I remember in my training there at Iowa, we treated at that time, we were one of the big centers for bone marrow transplants and, oral mucositis. And it was a big deal, still is. And I think if you go around the country, every cancer center, and they all need to have oral care associated with their treatments, with side effects of the chemotherapy, et cetera, they all have their own little concoction. And there's sort of some national trends, but do you make those kinds of concoctions as well?
We do make a few, especially tailored towards oral mucositis. I'd say our mainstay right now is triamcinolone still.
Mhm.
However, we make a formulation that doesn't have additional flavors, excipients that are going to cause increased drying or irritation, as well as we do make a number of different gels that can be applied to particular areas in the oral cavity that are more mucoadherent, so we're not just having that quick washing away via any saliva that's produced. So we do have a few different steroid topicals that we make and add additional components to as necessary.
Quick question. We hear a lot, and I think Karen Baker was one of the first who told me about this, is oral probiotics. I think the mouth is the first part of the gut. You hear a lot about gut probiotics. Are you getting a lot of requests for oral probiotics, and do you sell them?
Yeah, I have had a few questions regarding oral probiotics. Right now, there aren't a lot of great options. And something myself and actually a number of other practitioners are looking into is the potential to create some sort of chewable oral muco adherent probiotic. And so looking to see what options maybe exist or if that's a space where some research can be done here in the coming years. So it's been a hot topic recently.
Yeah, well, I want to keep in touch with you on that one because I hear a lot about it. So as a final question that's kind of looking into the future, I saw, and I mentioned this to you, that, Amazon bought this pill pack company. Seems like, they want everything delivered to my front door. Don't have to go to the pharmacy anymore. We made it more convenient by putting it in Safeway and everywhere else. But now maybe the next step is mail order everything. So tell us a little bit about the benefits of that. And, what do you see that happening in a bigger way? And how does that affect oral care?
Yeah, so with the different mail order pharmacies and Amazon Pill Pack, we do tend to see an increase in patient compliance. Those medications come to them even in little packets that have all of their medications, and for the morning in one packet, the noon medications in a packet, the bedtime medications in a packet. And so that can help to increase compliance with those maintenance meds. What can become a bit of a challenge is our more acute medications. So if a patient needs something for an infection, or if they've had a procedure and need an acute pain medication, those different mail order and pill pack facilities tend to be a bit slower getting those to the patient. And so we do still go the route of going to your local pharmacy of your choice to pick those particular medications up. I see a huge value in the mail order in terms of things like our different oral rinses that someone is on for maintenance treatment. Any of those high fluoride toothpaste, those can be really great as that mail order because they're getting that shipment every month rather than, oh, I'm out, I'll just get it next time I'm out and about. They can get it sent directly to their door.
Well, this has been fantastic. You've enlightened us into a lot of subjects. I know I'm going to want to follow up with you on a future podcast. So, Dr. Dunleavy, thank you so much for being with us on Pedo Teeth Talk.
Thank you so much. I appreciate you having me.
Do you need additional CE hours but don't have time to travel to courses? Did you attend annual session and want to listen to the audio recordings? Check out AAPD's new Education Passport. The redesigned and improved Education Passport is AAPD's online learning center, where you can earn CE and listen to audio recordings from all of our continuing education courses and more. Visit educationpassport.aapd.org for more information. For 10% off any product, use discount code TEETHTALK in the Education Passport store. Pedo Teeth Talk is the show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry. Be sure to check out previous episodes of Pedo Teeth Talk, as well as our other podcast platform, newly erupted. All previous episodes are available on our website. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.